Welcome to this resource on cholecystitis, inflammation of the gallbladder. We're going to cover helpful information you might see on exams, as well as practice questions at the end. But first, welcome to Artemis Interactive Media. Artemis is your guide to learning resource supplements and content overview for continuing education. You might note a clover at the top of this resource that indicates a subject commonly covered in Med-Surg, with the color indicating the body system. This quick timeout is a short study break and will cover cholecystitis, inflammation of the gallbladder. And if we need any help, Artemis will be here to guide us. Cholecystitis is inflammation of the gallbladder, most often caused by gallstones, which block bile flow. This blockage can cause inflammation, swelling, and sometimes infection, and even rupture. In most cases, it happens because gallstones block the normal flow of bile. The gallbladder is a small organ located underneath the liver, and its job is to store bile, which helps digest fat. When a gallstone gets lodged in the cystic duct, bile cannot flow out properly. This causes pressure to build up inside the gallbladder, which leads to irritation, inflammation, and swelling. Over time, if the blockage is not relieved, bacteria can grow in the trapped bile, increasing the risk of infection and possible rupture of the gallbladder. Common symptoms include right upper quadrant abdominal pain, nausea and vomiting, fever, and pain that worsens after eating fatty foods. Risk factors for cholecystitis include history of gallstones, the female gender, obesity, and a high-fat diet. Understanding these factors help identify individuals at increased risk. Diagnostic testing may involve ultrasound imaging, blood tests, liver function tests, and sometimes CT scans if needed to evaluate inflammation and complications. Complications of cholecystitis may include gallbladder rupture, infection, pancreatitis, and sepsis. Prompt treatment helps reduce the risk of severe illness. Medical treatment includes IV fluids and pain management, antibiotics if infection is present, dietary modifications such as adhering to a low-fat diet, and often surgical removal of the gallbladder is required. Nursing care focuses on monitoring pain and vital signs, assessing nutritional intake, monitoring for signs of infection, and providing patient education about treatment and recovery. This often includes avoiding high-fat foods, following postoperative instructions, and attending follow-up appointments. In summary, cholecystitis is a common gallbladder disorder often caused by gallstones. Early diagnosis and treatment help prevent serious complications and improve patient outcomes. Pain management and nutrition are important, and surgery is a common treatment. Before we test our knowledge, it's important to understand that cholecystitis can be a complicated topic to understand. It may cause effects that require different treatment considerations. The following questions will test our knowledge on the material we covered in this resource. So please answer the following 5 questions to gauge our mastery of this material. And don't worry, if we need any help, Artemis will be here to guide us. Question 1. A nurse is teaching a client about cholecystitis. Which statement best describes this condition? A. Inflammation of the gallbladder. B. Infection of the appendix. C. Chronic inflammation of the pancreas. Or D. Inflammation of the liver. Well, I'm going to say A. Inflammation of the gallbladder. And Artemis says we're right. Cholecystitis is inflammation of the gallbladder, most commonly caused by gallstones. Question 2. Which complication may occur if cholecystitis is left untreated? A. Hyperthyroidism. B. Cushing's syndrome. C. Gallbladder rupture. Or D. Cystic fibrosis. And I'm going to say C. Gallbladder rupture. Severe inflammation may lead to rupture and infection. Question 3. A nurse understands that surgical removal of the gallbladder is called A. Appendectomy, B. Cholecystectomy, C. Nephrectomy, or D. Adenoidectomy. I'm going to say B. Cholecystectomy. And we're right. Cholecystectomy is surgical removal of the gallbladder. Question 4. Which symptom is most commonly associated with cholecystitis? A. Right upper quadrant abdominal pain. B. Left lower quadrant abdominal pain. C. Severe headache. Or D. Cullen's sign. And I'm going to say A. Right upper quadrant abdominal pain, which is a hallmark symptom of cholecystitis. Question 5. A client recovering from cholecystitis asked how to prevent future symptoms. Which statement by the nurse is most appropriate? A. Follow-up appointments are unnecessary. B. Diet has no effect on gallbladder disease. C. High-fat meals improve gallbladder function. Or D. Avoiding high-fat foods may help reduce symptoms. And I'm going to say D. Avoiding high-fat foods may help reduce symptoms because low-fat dietary choices may help reduce gallbladder stimulation and the symptoms. Thank you for your attention to this resource presented by Artemis Interactive Media. This presentation may be used for content review and clinical competencies for pre-conference and post-conference education. This quick timeout can also be used for a short study break. Cholecystitis involves more than this QT covers, so for more information on this disorder, please contact your instructor and refer to your textbook. If you would like to review the references used in this resource, you can find them here.